Are we live? We're live. Let's talk about mental health care and accessibility and insurance companies. Can we talk about that for a moment? Because these are some topics that we've been talking about all week with amazing therapists from around the world and across the country who are trying to figure out, how do we make mental health care more accessible? How do we do that? Like, what needs to happen? And trying to make really hard decisions about their business based on trying to say yes to insurance contracts while also doing the math and finding that often those insurance contracts aren't really accessible for them. Meaning, if they were to say yes to those insurance contracts, they can't actually provide good services to people because they would need to have 30 or 50 or 60 clients on their caseload. So I want to talk about what's happening with insurance reimbursements, whose responsibility it is to make sure that mental health care is truly accessible and accessible via insurance plans, why insurance reimbursement rates are really low in some areas and not so low in other areas, what we can do as a profession to talk about how we can advocate in a global systemic level on a state-by-state basis to make insurance more accessible or more viable for more therapists to be able to say yes to it without it being if I say yes to insurance, I'm saying no to myself. If I say yes to making this more accessible, now I'm kind of in this catch-22 kind of place. So we're going to dig into all of that if you're okay with it. So let's talk about first question, which is, whose job is it to make sure that there is accessible mental health care within the insurance company, within the insurance, on a panel, an in-network panel? Whose job is it ultimately to make sure there are qualified clinicians with space that can take on clients? Ultimately, it is the owner of the business who's providing those services, which is actually the insurance company. The insurance company is truly the person that is responsible and that should be ensuring that they are providing good quality care that's accessible and available. They should be ensuring that they have reimbursement rates that are viable, that they have adequate coverage, and that the kind of services that people need are actually available. Otherwise, it becomes kind of like phantom insurance. Oh, hey, I have this insurance plan, but I can't find a doctor that takes it. I have this insurance plan, but I can't get into, there's no hospitals that take this insurance. So there are actually protections in place for clients, for patients, for consumers when that happens. You can actually even advocate for your client. They can call up their patient's rights advocate and they can say, hey, this feels like phantom insurance. There are 50 people listed in here, and 49 of them or 50 of them don't have space, or they have a waiting list of 8 weeks, or, hey, of these 50 people, I have PTSD and none of them, there's no females that specialize in trauma on your whole list. What are you going to do? And then it's the insurance companies, truly their responsibility to ensure that you have access to care, right? That's it. You have access to care. And so then they have the responsibility to reach out and to do single case agreements or to try to attract the appropriate people that are needed for the care of their people, right? Because that's what their role is. That's why I, as a consumer, am paying my insurance company hundreds of dollars, probably per month, maybe thousands of dollars per month, depending on the size of your family and what kind of plan that you have. I, as the consumer, am the person that has the most power in the scenario, okay? In terms of being able to say, hey, I paid you money and I didn't get what I paid for. Help me out. Now, because a lot of insurance companies are not as focused on client care and quality care as they could be, as they should be. They are really focused on bottom lines. I actually pulled up for last year, for 2020. Do you know how there was 1,031 insurance providers, like big organizations? Do you know how much profit they make? And I'm going to say profit. This is after they have paid all their employees, they've paid all of the contractors, they've paid all the therapists. They have taken whatever they're paying for their executives who may have salaries in the hundreds of thousands or the millions of dollars, for depending on the CEO or CFO or whatever that is. They made, as a whole, $31 billion profit after all expenses, after all those salaries, after all of the things. They had a profit of 31 billion in the healthcare industry. To give you a way of comparison. Now, and this isn't a direct comparison, but $31 billion, of course, across 1,000 different health insurance providers, but that's about 30 million per piece. Okay, 30 million for each of those 1,000 different people. But 31 billion across healthcare in the United States. Do you know how much Amazon made last year? 21 billion. More than Amazon. Healthcare is bringing in more profit than Amazon. And who are the people trying to make sense of it all? Who are the people saying yes to reimbursement rates at $30 or $60 or something that really doesn't work depending on where they're living? It's therapists. It's mental health care providers who are trying to bridge this gap, while insurance companies as a whole are making these huge profits. How does that feel? How does that feel when you are bending over backwards to put things in place and try to make this as accessible as possible, and finding that, hey, I'm struggling to find plans that will actually take someone in, or when I do get the reimbursement rates, they are not a livable wage. A lot of insurance plans, they haven't increased their rates in 15 years. Some insurance plans are reducing their rates. We're hearing of insurance plans that are going back and doing clawbacks. And these clawbacks are not based on, hey, we did an audit and we found that you weren't actually providing the services, or you did a crappy job doing your documentation. These are just general clawbacks where they say, hey, you know how we said this person had services or that they had insurance? We decided they didn't. Something else was there and we just looked it up. So that client that you saw 5 years ago, we're going to claw back hundreds or thousands of dollars, and we're going to take it out of your paycheck right here today. And then we're going to leave it on you to go and try to find that client to get the money that we already paid out to you, that we already told them that it was covered. We told you that it was covered. We paid you 5 years ago. And now you're sitting in a place where you can't pay your mortgage or your current bills because an insurance company gave you misinformation 5 years ago. Isn't that can I hear, how do you guys feel about these things? Do you know that these things are out there? And this is what gets in the way of having health insurance be really something that easily covers mental health care, because we have these providers who can't live in fear of when a clawback is going to come 5 or 10 years later. We have these providers who can't live with, hey, I'm living in a place where a single family home costs $900,000 and I'm getting reimbursed $68 for a 52-minute session or what have you. That's not viable, right? And here's what happens is a lot of therapists haven't run the numbers. They just know they want to make mental health care accessible. And so they have this place of just hey, I'm going to get on insurance. It's really important. But then when they run the math, what they find is that, for example, maybe they ran the math and they realized, you know what, to give good quality care, I need to charge about $100 a session. That's my average. But if insurance is reimbursing $68, right, then and I'm seeing half insurance and half private pay, then in order to pay my bills, I need to have my private pay clients pay $132 to subsidize the insurance clients, to subsidize the low rates that are over here for the people that are coming through insurance, right? So now we have this place where we're actually having people, again, subsidize the insurance plans that made $31 billion last year. $31 billion last year. And we're also creating more work for ourselves because some of these insurance plans, not all, this is not like against all insurance, but there's a lot of insurance plans that are running people in circles. People are spending hours on the phone. They're getting random denials for no reason. They're getting random audits for no reason. And so the cost of doing business is actually higher with the insurance covered, with the insurance plans, the managed care providers, than it is if someone was just doing private pay. So now we've increased the cost overall, which again increases what that hourly rate needs to be. Does it not like make you a little bit crazy to know that insurance managed care made $31 billion last year in the United States? And therapists are struggling over just getting paid for the work that they do on a regular basis, right? And again, this is not from state to state. There are some different regulations that people are putting in place that they're advocating for. And I want to talk a little bit about that because each of you probably has a state organization for your particular license designation. And I think we need to start getting really clear with our professional organizations of what we want as a profession. And one of the things I've seen in Illinois, they've been doing some great advocacy in terms of insurance. And one of the things that they're having that is going into place January 1st of 2022, insurance companies in Illinois have 1 year from the time that they pay someone to do a clawback. 1 year. That actually sounds kind of reasonable, right? Hey, maybe there's a mistake. Sometime in the next year, you have a chance to like put it to fix it. If there's really truly a mistake, they have 1 year to fix it. Not 5 years, not 10 years, not it goes on forever, 1 year. Several years ago, they moved that from several years in Illinois to 2 years. And they said, you know what? No, it needs to be 1. Because you as a provider have sometimes 60 or 90 days from the date of service to submit that paperwork and to get paid. Or they say, oh, nope, we can't pay you. It only seems fair. It only seems fair. So I think we need to do that. I think the second thing that we need to really look at is we need to start running those numbers and getting really clear as to what is the average fee that we really need to be bringing in. And we need to say no to insurance contracts that don't work with this. This is not something that a professional organization can advocate for you guys, okay? That's price fixing, that's an issue. You cannot have CAMFT or ACA or anybody else come in and say, hey, this is how much. You have to reimburse people at least $88 for a 908(c). Nobody can do that. Nobody should do that because they don't know what your business expenses are. But you need to get clear about what your business expenses are. You need to get clear about what that average fee is that you need to be bringing in. And you need to make a commitment to say, I'm not going to sign contracts and accept contracts that don't work for me. That fee is not there. I'm not going to continue to subsidize insurance companies' profits with my private pay clients or with my own health and well-being. Can I get an amen? Like, is anybody here ready to say, I'm not going to continue to subsidize insurance companies' profit with my emotional toil and hard work and like making myself insane trying to work within this broken system? The system needs to be repaired. And there are ways that we can do that outside of the system and some ways that we can do within the system, but there's some limitations. And we have to make the decision to say, you know what? I'm not going to sign a contract that doesn't work for me. And when that happens enough, guess what happens for insurance companies? Their cost of business, their business decision, their usual and customary rate is based on a business decision. How many therapists can they get to sign it? And will that meet the basic needs so they don't get sued by their members? Right? That's it. So if we want to see things change, we have to say, you know what? No, I have to make business decisions for my business based on the cost of living, based on my energy, based on my health, based on my family needs. Just like they made their decision about what works for them, I get to say yes or I get to say no. Is this sinking in for anybody? Is this bringing up like any kinds of like questions or thoughts? Now, to give you an idea too, when we go back to this idea of 31 is actually, $31 billion worth of profit. I was like 31 point something, no, 31 billion. In 2019, they only made $22 billion in profit. So their profit went up during a pandemic by $9 billion. And did we see raises coming from insurance companies across the board? Did we see them, really providing more support and encouragement? Or did we see that insurance companies were doing more audits, doing more clawbacks? That's what I saw. What did you see? I'm really curious. What are the questions? What are the thoughts? What are the concerns that you have about accessibility and insurance and mental health care? I want to hear those questions. I want to see them, post them. Let us support you in figuring this out and really trying to fix this broken system, right? If there's two things you take from today, let's advocate for some legislation. Let's take this legislation from in every single state that insurance companies have 1 year for clawbacks from the date of service or from the date of payment. And let's not sign contracts that don't make sense for us. Let's do our math. Let's really own the fact that we're business people and that we're valuable. And we're not going to sign contracts that don't work for us. Right? Who's with me? It's a very, very quiet group. But I just want to put that out there. Two things, two takeaways. Do not sign contracts that do not work for you and your needs. And let's advocate through our professional organizations. Let's write letters to our professional organizations and say, hey, this is the legislation I want you to push through. No callbacks past a year after the date of payment. Totally reasonable and totally doable without getting into any issues in terms of price fixing or any other kind of legal issues. Who's going to connect? Who wants to tag their let's boycott? And I think that, there is something about kind of the idea of boycott, but that's what signing contracts, not signing a contract that doesn't work for you, right? It's better than boycott. I pinky promise. So, and again, let's tag your professional organization, tag your ACA in this, tag CAMFT in this, tag APA in this. Let's go state by state. I love this idea. We're having a lot of advocacy right now of having a reciprocity state by state. I think before we have reciprocity state by state, even though I think that one's huge on the list, I think we need to revamp this insurance company issue and debacle, right? Let's really make it accessible. Again, clawbacks, no more than a year, period, in a story. Let's tag our professional organizations. Let's be really clear on how this benefits everybody involved. And let's do our math. Let's own our role as business people and say, you know what? If it's under this amount for me and my business, I don't sign the contract, period. I'm not going to have my private pay clients subsidize poor insurance rates any longer. All right. Sound good? Are you with me?